Hello, this is Dr. Gay from First Look MRI, and this is just a bread and butter case of meniscus tears on both sides. The medial and lateral menisci are torn. The patient was born in 1963, and these are just common meniscus tears that you see over and over again, so it's important just to be able to catch them really easily and quickly. And so to start off on the lateral side, here's a lateral meniscus. On this midline coronal sequence, you see the medial meniscus looks great, nice triangular. It's not pseudo-extruded, not pushed outward, so hey, that looks pretty good. On this side, though, the meniscus is very small and irregular, and we see over here this big glob in the central part of the knee joint hanging over the tibial spine. So this is a large bucket handle fragment. The meniscus is torn from the anterior horn, the body and posterior horn, and this large bucket handle fragment is drifted into the central part. And this is just a very classic look and pretty common type of a tear. More often, I see the meniscus tear, the part that is displaced inward, the bucket handle fragment, is very small. Sometimes it's almost impossible to see or really difficult to see. And the meniscus is almost normal in morphology. This one's very easy because the meniscus is small and irregular, and the meniscus bucket handle fragment is huge, so this is super easy to see. But again, when you have a small bucket handle tear, they can be really challenging. Now on the opposite side, the medial meniscus, we have the meniscus body. Here looks great. It's not pseudo-extruded, so at first glance, like, hey, this is pretty good. If you look back over here, you say, well, the posterior horn looks pretty good. The anterior horn looks pretty good, but this is a case of a tear of the meniscus root. So the medial meniscus posterior horn comes over here, and the root attaches right over here by the base of the PCL. And the meniscus root, there's a vertical bright signal here. So this is a radial tear of the meniscus root. It's torn off the bony attachment and drifting outwards. And right now the meniscus is not pseudo-extruded, but with time this will go out, and then it'll cause abnormal stress on the medial side. And often you see marrow signal changes, but again, this one must be recent, and we see the separation, but we don't see any of the other changes yet. If we put up a sagittal view, the medial meniscus looks pretty good. There's the posterior horn, a little funny thing out here in the back. And then right here, we see this gap. That's the radial tear. There's a gap within it. Again, it's separated from the bone. This is the bony attachment right over here. It should fit right underneath here. So radial tear of the medial meniscus root, and then a complex, large bucket handle tear of the lateral meniscus.